trying to stretch out your tight hip flexors, but you're not making any of the progress you want, in this video, I'm gonna teach you some of the best exercises you could do to fix this. What's up, Dr. Nick here, back to go over hip flexor tightness. Now, really we have to differentiate between two different things when we're talking about hip flexor tightness. Is it tight because it's actually lacking flexibility, or is it tight because it's lacking strength and stability in another region? So we've got to zoom out and really focus on what we're actually working with to begin with. So when we're talking about tight hip flexors, it's usually, the common one is the psoas muscle, which has attachments to the lumbar spine. It courses down to attach to our hip bone, which brings our hip up into hip flexion, i.e. the hip flexors. But then there's also other components of muscles that can contribute to the tightness that also flex the hip, like the rectus femoris. That's part of one of the four quad muscles that also bring the hip into hip flexion. And there's other hip flexors, but the primary ones that we're gonna be addressing in this video is the classic psoas muscle, those hip flexor muscles. Now, when we're thinking between strength and mobility, how do you know which one you have to work on? Starting with a test to see if you are actually stiff and tight to your hip flexors. You need a table or a chair that you can actually just lean back on. So what you're gonna do is bring one leg to the chest and you rock all the way back, bringing this knee all the way to the chest as far as you can. Then from here, the leg that is you're not hugging, you're just gonna let it relax naturally. So you don't wanna be actively holding it up. You let it just relax and see where you are. A good idea is to get a picture or film yourself doing this so that you can get a still image of this. And the main thing is that we're looking for is this leg right here, the downside leg. We're looking to see if you can get the back of your thigh in contact with the table, or if you're on a chair, the chair. The idea is if it can, you likely have good mobility into the hip flexor region. If it's actually up like this and it won't go down any further and you can't get your knee or the back of your thigh into the table or to the chair, then you know you're lacking some hip flexor mobility because it's stiff and tight in the shortened position and it won't let you go down. That's more of a tightness issue in this case with this particular test. Now, when it comes to strength, we could do a simple one to test the endurance of the hip flexor region. Now, endurance component is a good way to address this hip flexor weakness if it is a problem, because we can be pretty powerful in our hip flexors with 1 or 2 reps from a power standpoint, but more of an endurance aspect to this and a little bit of a bias towards endurance can give us more insight if the muscle fatigues more or if it's feeling hard to hold a position. So it's good to get at this from an endurance standpoint for this video. So the way you're gonna do that is just, you could hold on to a little bit of support or like a pole, and you just bring your leg, your knee towards your chest into hip flexion. Try to get a little bit at this 90-degree angle or maybe slightly a little bit higher. That's gonna shorten the hip flexor region and you're just gonna hold it. A good time that you wanna hold this without dropping your leg lower is about 30 seconds upwards to a minute. If you could hold this for 30 seconds or a minute, then you probably have good low level, sufficient strength to the hip flexor region, and it might not be a strength issue that you're dealing with for the hip flexors if you could actually pass this. But say you're holding this and you're cramping big time. It's a struggle, you're starting to shake, and it's hard to actually hold this position for 30 seconds or a minute. That can give you some insight onto, okay, this needs more work from a strength perspective. You could also test side to side. So if, for example, the side you're always stiff and tight in, it's a struggle to hold this for 30 seconds or a minute, but it's very, very easy to hold it on the other side, then you can get more insight to say, okay, this needs more strengthening aspects to this. In this video, we're gonna focus on the aspect from a strength component, and we're gonna address the hip flexors with 3 main exercises. Let's get to it. When it comes to strengthening the hip flexors, we have to look at it from both ends, a shortened position and a lengthened position. We do really well in these mid ranges of motion, but we wanna work at the end spectrum so that with the whole muscle can function through a range of motion. So the first exercise we're gonna do is in a shortened position as much as we can. We have a band on my feet to add a little bit of a challenge for this exercise. What you're gonna do, you can hold on to a little bit of support as well. From here, you drive the knee up as far as you can towards the chest and just hold it. Now, depending on your strength tolerance, it might be hard to hold this more than a second or two. And also depending on the resistance of the band too. But the idea is you want to fatigue this out to get more time under tension to this area or the hip flexors so that you get more input into the system. Because if I just rep it out, 1, 2, 3, there's no time under tension of the hip flexor region until we get to the end range where we're just holding it for a split second and then coming back down. So we're gonna raise up, we'll hit it from an endurance standpoint, and that's how we're gonna address it. So you go all the way up, you hold it as long as you can. Say you hold it for 30 seconds, and then you drop down. That would be 1 set. Then a good idea is to build up to about a 2-minute duration hold of this. Now, not just 2 minutes straight, but 2 minutes in accumulation, because 2 minutes is a good enough input to actually start to make some change from a structural standpoint. So in this idea right here, if we hold it for 10 seconds and then come back down, hold it for 10 seconds, come back down, hold it for 10 seconds and then come back down. When we take a break, that's 30 seconds. You repeat that 4 sets, that's 2 minutes right there. So the idea is to get more input to that, and we're working at that end range of the hip flexor strength to ultimately improve its ability to get stronger from an endurance standpoint. Now, the other end of the spectrum, we have to target strength in a lengthening position. We're going to be doing this with a eccentric motion. So I'm setting up on a bench. I have a weight to anchor myself down, but you could be creative by taking this concept and applying it. It doesn't necessarily have to be a weight. You could be attached to something else to anchor yourself down. Just apply the concepts here. That's the main thing. So from here, I'm going to be thinking as when I drop back, I'm thinking of bringing my leg up into the anchor point. That's going to address the hip flexors under load. So I'm activating it while pushing up. As I'm leaning backwards, that's going to activate all the hip flexor region, and then I come back and I reset. What we're doing here is bringing the hip from a hip flexed position. My hip is in hip flexion right here, and I go back. That's extending my hip, relatively speaking. When you extend your hip, you're lengthening your hip flexors, going the opposite way. So from here, I push up into the anchor point. I feel all of this working, and I'm focusing a mind-body connection of letting all this work to slow me down, and I come back up, and I repeat. Now, the concept here is to build isometrics up to about 15 reps, 3 sets of 15 reps. That's where I like to start with eccentric loading. Now, if you go heavier with, if I'm holding like a weight and then doing it, it would be less volume. But to just get started with this initially, I like that higher rep range and set range. So from here, really targeting the hip flexors in that lengthening position and under load. Now, you will also feel your core on. Now, the thing is though, if you're feeling more of your core on than your hip flexors, the core is just overworking because of the lack of strength in the hip flexors. You will feel both of them, but if the core is just over competing it, you can then use some assistance throughout this exercise to get more focused here. So there is going to be a mind-body connection of literally thinking of using your hip flexors to control yourself down into the position. But again, if this abs are kicking on to help it, you could then use some assistance to hold you throughout the position so that you can get more focused work to the actual hip flexor region. So imagine if my stall bars were right in front of me and I had a band attached. I can hold now the band and then use a little bit of assistance to control myself down to target this region and then pull myself back up. That will assist me throughout the range of motion, and I have that mind-body connection of really emphasizing the hip flexor to work throughout the lengthened position. The other strength component that we have to address while working on hip flexor strength issues is not the hip flexors, the opposite side of the joint, the glute muscles. So in this exercise, we're going to be focusing on the lateral aspect or the outside of the hip, because when we have strength issues in the hip flexor, it could be a result of lacking hip stability around the surrounding joint. So we have to address the opposite side. So from here, we're going to be just in a position where the foot is elevated on something just for a little bit of support. I bend this front knee, and from here, I'm just going to bring my knee out to the side and back in. And what this is doing is trying to cave this knee in like this. And when that happens, I have to use the outside of my glute muscles to then bring my leg out. So you will feel twofold with this, two areas of the body working. You'll feel this working because you're bringing it out, but you'll also feel the downside leg really burning this whole lower body working as you do this. The idea is to really address the glute muscles from a strength and stabilization standpoint. Now we get stronger here. This ultimately will help decrease some of the stiffness and the tightness you feel from the hip flexor region, but at the same time, you're hitting it from a strength component because you're addressing the opposite side as well. With this, I like to get a higher rep range and set range, especially in the beginning, to get more input to this. So about 3 sets of 12 to 15 of these to really fatigue it out. Now say you're doing that and you don't feel anything working, you can manipulate the sets and the reps to meet your challenge. So for an example, if I go out like this and I hold it for 10 seconds and I come back and I hold it for 10 seconds out and I come back, I'm starting to feel everything fire up. So you want to play within your resistance type, your sets and rep ranges, you're manipulating time under tension. The idea is to work on the opposite side, the glutes, to ultimately strengthen up everything at the hip flexor complex. So to recap, this video focused on strength exercises you could do to help your hip flexor tightness. We addressed it here from the problem being a strength issue at the hip flexor region. We addressed it locally at the hip flexor and also at the glute to really get more of a holistic kind of attack at this region. So I really hope you gained some insight and learned some things about this, and hopefully it gave you some value. Also, I'd greatly appreciate it if you really did find value in this and you liked this video, then subscribe down below to my channel, like this post, turn on your post notifications, leave any comments down below, and really looking forward to hearing some feedback from you and any other videos that you want me to make. Let me know down in the comments and I'll do my best to make them. This is Dr. Nick. I'll see you next time.